I'm only human, like any man or a woman. Lord, help me believe in what I could be and all that I am. Show me the stairway I have to climb, but Lord, for my sake, teach me to take one day at a time.
Welcome to Bringing Jesus to a Broken Heart. In the studio today, I have one of my colleagues and friends. Her name is Dr. Cooperman, and she is a neuropsychologist. So today's segment is going to be on dementia and the elderly. Welcome, Susana.
Thank you. Glad to be here.
So, Susana, even though I know you personally, and I do know some of your background, but for those who do not know what your special gift is as a psychologist, I know that you have a special area in the neuropsychology end of the studies. So what brought you to being a neuropsychologist?
Part of my training was at NYU, and half a year of that training was in neuropsychology, and I just found it really fascinating to learn how the brain works, and especially how trauma impacts the brain and how to assess that impact and then how to remediate it.
And that sounds very interesting, but for those who do not know like what a daily routine is like and what your tasks are and the testing that is done, can you tell us just a little bit about what your daily routine is?
I don't only assess people for dementia. I see patients for psychotherapy, and usually the assessment for dementia, I see the patient twice for an hour and a half each. It's usually done within a week or within 2 weeks. And then the data is scored, interpreted, written up, and then the feedback session is next week.
And may I ask how you get the referrals, like for dementia screening? Is it basically family members that call, or?
Usually it's the family member who picks up that there's something wrong, that the spouse or parent is becoming more and more forgetful, and the first step is usually a primary care physician who will then make the referral to a neurologist who will then usually refer to me. Because the problem with dementia is you cannot see it on an X-ray or MRI. Dementia can only truly be diagnosed after you're deceased. So they come to me because I do pen and paper tests and find out that somebody has dementia.
That's very interesting, because for anyone listening, I don't think that is clearly always known how it is diagnosed and what some of the treatments are for dementia, or who is the right clinician that would diagnose that, right? I mean, sometimes we hear that all the time. Where do we go? What practitioner do we go to if someone has dementia? So that's very interesting.
Usually after I diagnose it, then the patient is sent back to the neurologist for whatever treatment can be done. There is no cure for Alzheimer's, for example, but there's medication to alleviate the suffering.
As a neuropsychologist, can you answer the question as far as what is the criteria that you need in order to be diagnosed? So what does the DSM say regarding what's the criteria?
The criteria is that I first get a baseline functioning of the patient, an IQ, and then I run memory tests, and the achievement on these memory tests are supposed to be at the same level than the IQ. So if you have an average IQ, you should be in the average range for your memory functioning. When that is not the case, then we know a deterioration has happened or has begun, and that is usually then a diagnosis of dementia is made. Alzheimer's dementia is progressive, and so we don't usually know when the disease starts. But at some point when it impacts functioning enough that the person can't really take care of themselves, then it's diagnosed.
And is there a correlation to genetics for dementia?
Yes, when they see the patient for the first time, I ask about family history. There's unfortunately a correlation, and once a patient has been diagnosed with dementia, the children have to be more aware of being at risk.
Okay, so that's very interesting if anyone's listening on dementia. Based on research, are there any clinical findings that have been FDA approved to stop or prevent dementia?
There is no cure for Alzheimer's. We have medication that can slow down the deterioration, but at this time there is no cure.
So that prognosis is very hard for patients.
Very harsh. But research shows over and over that exercise is the number one factor that helps slow down deterioration. If you exercise, you vasculate and oxygenate the hippocampus, which is for memory functioning, and so you remember better and longer.
And that was my next question. What is some of the treatments that are out there for someone who's been diagnosed with dementia? And what are some of the, I mean, we all know that, clinicians work with groups and do family work, but who do you think in your estimation is the most affected by dementia? And we know the patient that goes through it probably doesn't have a lot of the internal feelings as much as the loved ones that are affected directly in maybe caretaking. So do you feel like there's a little bit more of the stress for those that are caretaking or for the ones that actually are diagnosed? What do you think?
In the emotional area, usually the spouses or other family members suffer more than the affected patient because they see the person deteriorate. And a hallmark about Alzheimer's is that the patient is not aware of their impaired functioning. That's part of the problem, that they don't realize that they can't remember. So a lot of counseling is done for the caretaker, and they have to really watch that they don't burn out and take care of themselves and get support.
If you could share this or comment on one of the last questions, we talk about a lot from a spiritual perspective, and the show's for the Catholic social workers, but I just wanted to just ask, what do you feel is the best course of action in treatment to help a patient still maintain their dignity and respect? So in other words, they may lose some of their ability, their executive functioning skills, they may not be able to drive. How do we keep the patient feeling that they have autonomy over their life still, and yet we have to be realistic about what the diagnosis and the prognosis is leading them towards as far as end-of-life issues?
That's where the testing is really important, because I look at all functioning of a person: reading skills, auditory processing, driving, arithmetic. I assess the weaknesses as much as the strength. So it's very important, if a person is still able to do something such as cooking or driving or reading, that the person engages in that behavior. The problem with dementia very often is that people just sit in front of the television all day, and then if you don't use the brain, the deterioration accelerates. So it's very important to walk, to have a social life, to interact with people, and to stay active and do something with family members.
Is there any spirituality that gets incorporated into treatment that you may know of as an outside resource?
Well, if the spouse or actually the patient themselves are religious and practicing their religion, they can gain tremendous strength from prayer and going to church or to services, and having also their religious community support them. And daily prayer absolutely helps to strengthen and helps a person to deal with the loss and the grief that is inevitable, and it helps prepare a person for the loneliness that might come.
Well, Dr. Cooperman, it's been a pleasure doing this show with you. I really think that this is a great topic to go forward with and continue on. So we would love to have you back to do a little bit more of series on this topic and maybe other ones from your neuropsychology perspective. So once again, it was great having you here today, and thank you for being on Bringing Jesus to a Broken Heart, and God bless.
One day at a time, sweet Jesus, that's all I'm asking from you. Just give me the strength to do every day what I have to do. Yesterday's gone, sweet Jesus, and tomorrow may never be mine. Lord, help me today, show me the way, one day at a time. Lord Jesus, be with me. For this I pray. I give you my heart, do what you must do to make me like you. In giving to others what you've given to me. But Lord, for my sake, teach me to take one day at a time. One day at a time, sweet Jesus, that's all I'm asking from you. Just give me the strength to do every day what I have to do. Yesterday's gone, sweet Jesus, and tomorrow may never be mine. Lord, help me today, show me the way, one day at a time. One day at a time, sweet Jesus, that's all I'm asking from you. Lord, help me today, show me the way, one day